Thank you, Liz. I'd just like to make the point here that having agreed safety valve, I continue to have huge concerns about this. Um, I don't think I can vote yes that there is suitable provision because the entire basis of SEN provision in this borough is now predicated on saving money. It is not predicated on meeting the needs of children. It is about limiting access to EHCPs. It's about limiting access to the high needs block. It is about putting children into provision that is unsuitable in order to save money. And the reason I believe this is unlawful is because, in fact, limited resources is not a basis in law to restrict EHCPs. And yet that is exactly what we're predicated on doing it. We saw in the briefings we had that there is a desire for the local authority to reduce the number of EHCPs. They want to, they had a whole graph, a whole table, sorry, showing us about they wanted fewer EHCPs. There should be no plan to reduce EHCPs. If children need them, they should get them. There should be no quota. Safety valve has led to a reduction in services. I call it cuts. I know that other people call it efficiencies, but there are fewer services to call upon. I've already seen in my own school children who absolutely should be being placed in a special school, suddenly being told, no, mainstream's perfectly fine for them. But funnily enough, the amount of money, top-up money, is not going to keep them in mainstream for long, as far as I can see. And I'm afraid that SEN provision in this, as I'm going to repeat, is utterly predicated now on saving money. It is a fallacy because we're still going to end up in deficit at the end of it. We all know what will happen at the end of it in order to pay off that deficit. Local council taxpayers don't, which is an utter outrage and anti-democratic. And I'm absolutely refuse to vote to say that things are fine in this borough when they are not. SEN provision is a shambles and it is not predicated on the needs of young people. And it is overwhelming schools. It is not meeting the needs of children, and it is beginning to affect children without SEN because they're not getting the support they need because we do not have the resources to do our job in schools. So I will not be supporting it. If I'm the only member to vote against it, fine. But at least I'm now on the record with my view publicly.
Liz, can I come back in on one or two of them points, please? Yeah, so in terms of the modelling grant, we are not saying children are not having plans, and we've been clear that those children that absolutely need them will have access to education, health and care plans. In terms of the modelling, we are actually seeing a growth in plans over the next 5 years, so that there's no suggestion that we are going not to give plans. On another note, when you talk about provision, we are investing, the council itself is investing into the SEMH provision. We are building more provisions. We are actually creating more places. We're not saving money per se. We are trying to bring our in-year overspend. We are spending more than we are allocated into a balanced budget. So it's not as if we are taking this money and putting it elsewhere. We are not. And when we look at the out-of-county placements as part of the high needs block and the DSG, it is one of our biggest spends. Yes, and as a council, we are investing in local provision within local communities and local schools, and that's clearly outlined in the report. What the more to look at is early intervention, is to get that support in as early as we can and to ensure that we access all services, including early help, across the local authority. Thank you.
Thank you. Other hands up? Welcome, Stuart. We are just talking about 3.21, which is the education of pupils with SEN, whether there's appropriate placement arrangements in the...
Liz, in lieu of any other hands up, can I just come back to that? So I absolutely get that there is a plan for local places. Those places are not here yet. So in the meantime, there are young people that do need specialist places where there is nowhere for them to go locally. And so far, the plan seems to be is to keep them in the mainstream school. And, they can just stay there until at some point in the future, there is a place locally to have. So that's, I've had within the last 2 weeks, 2 cases exactly where that's been the case, where it's beyond my understanding. So secondly, we talk about early help. So far, we've had things where we've actually asked for help and early help, and everything's been batted into the long grass. Nothing's being done early. So I'm afraid it doesn't ring entirely true from what you're saying, and I totally understand you're reinvesting, but in the meantime, we're not meeting the needs of children in schools right now, and that is a problem. And at the end of all of this safety valve process, we're still going to owe millions of pounds, and we're still and we will have, yes, we may have reduced our in-year deficit, but we're still not going to be meeting the needs of the children. So the SEN provision in Bracknell Forest is not fit for purpose. We are not meeting the needs of children right now in our schools. I admire the ambition, and maybe in 5 years' time it will be amazing, and I'll happily eat my hat. But right now, it is not meeting the needs of the children in the borough.
And Grant, can I come back in there, Chair, please? And, we are working with the schools, we are working with our current resource provisions to make sure that we do have a outreach provision to support schools in meeting the needs. We are still using our independent sector to meet some of the most complex needs, and we are trying to make sure that all our children are in the right place, Grant. I accept that the provision we have at this moment isn't where it should be, but we are working at pace to make sure that we have adequate provision in place for our children, and continue from a heads meeting this morning I've had with heads. I'm more than happy to have conversations with the head teachers in creation of more resource provisions at primary if that is what's needed.
So Dwayne, I really appreciate that. What you're talking about is in the future. It isn't in place now, and we're being asked to vote right now whether provision meets the needs of children now. And I don't think you can say that it does.
I'm not saying it does at the moment, Grant. What I'm saying is that we are investing heavily as a council to make sure that the provision is going to be in place. For this September, we are opening a 5-place provision at Sandhurst to meet the needs of some of the children there, bringing that forward. We have a building programme which the council has taken on board to build these provisions themselves so we can get it done at a faster rate. And we've written to the DfE to ask for permission to do that as well, and presented a business case. So we are working really hard. In terms of the children this year, we are having to place some children out of county, and they are those with the most complex needs.
Okay. All right, let's have some more comments, because what we're being asked to agree is fundamentally, do we think the plans that are in place will lead to an ease in the crisis for SEN? Or do we think this plan that's been put together isn't quite there yet? Okay, Juanita.
Liz, I'm just going to say, because this Grant is saying that it says that it is adequate now, but you're saying that it will be. So which one are we voting for? That it will be, or that it is presently now?
I think it's talking about, so if you read the top of page 86, there's recommendations that the form agrees that for the 24-25 financial year, that there's appropriate arrangements in place for the education of pupils with SEN.
Well,
not describing right now.
Okay, I will say first of all that I've noticed a big improvement in our support for SEN, but even in our school we have got 3 children who should not be in mainstream, and there's nowhere for them to go, and we're told we might have to have them for another couple of years. Sorry, John.
So the plan that will be in this is do we think what's being described here will reduce it? So my thoughts was around page 93, if that's okay, if we can turn to page 93. Commissioning, block contracts, external provider, reduction fee, banding tool. So there's a section there which talks about the banding tool, to try to make sure it's in a fair and equitable way. For those of us who've been on the forum for a while, we have been talking about the banding tool for a very long time. Can we just have an update of where that is? Because it was a surprise to me, because I was the chair of the subcommittee.
Yes, in terms of the banding tool, we have agreed in previous meetings that the banding tool that heads tried and tested would be the tool that we adopt, and that has been agreed. What we are working on now behind the scenes is putting the value of money towards each of the sort of categories and to the level of need. So that is a piece of work we are undertaking, but we will absolutely be delivering on the banding tool the heads have worked on and have moderated over the past previous years. So and that will be going ahead.
Okay, the chance because it's saying it's going to have a cost saving of £750,000, and based on the comments we've just been talking about, we want to try to invest, if at all possible, to reduce the crisis. I can hear the words volatile in the report, and I can hear the words fluctuating. But if that to stabilise it now, you've given us assurances that you won't put a cap on EHCPs.
Can you hear me, Liz?
Yeah.
We're not putting a cap on EHCPs, I can be clear, we're not. What we have forecast is actually a growth in education, health and care plans. In terms of the funding, what we need to make sure, at the moment, the way the council funds the plans is very subjective to each case officer. So, and what we are doing is bringing in the tool that heads have co-produced and worked on and moderated, so the funding can be applied fairly and equitably across the system.
Okay.
We won't be putting a cap on education, health and care plans.
Right, I will come back to you in a moment. We've got some comments in the chat. So we've got a comment from Grania about 10 minutes ago saying that the budget shows we've had a high level of overspend. Katie, do you want to expand on your paragraph 6.25?
Sorry, I couldn't find my button. Sorry, 6.25 just expands a little bit on 3.2, point 1 and point 2. My question was really around, which is not the one we're discussing at the moment, so it may be that we just hang on and I'll come back to it. But I was just speaking about the pupil referral unit places, and 6.25 expands that a little bit, and obviously refers on to page 91, 92. About value for money services and education other than in school. But I think maybe we want to talk, we probably want to finish the SEND one first, Liz.
This one first, yeah, absolutely.
Thanks.
Grania confirmed that we've just had an email confirming that it's been agreed by ministers at 5:14. Tim, you suggested a change of wording, or does it need to say that? So Tim, your thoughts on what wording could we?
Pressing buttons. Yeah, so I just wondered, I don't disagree, Grant, with what you're saying at all, but I do think progress is being made, and you know, planning is much better. So I just wondered if there was anything we could do in terms of changing the wording to, you know, to support the comments that I think we all agree that Grant's just made. However, I think it's also fair to acknowledge the progress and the planning that's now in place.
So something along the lines of that.
Well, so in front of me, just because there's messages flitting around a little bit, so progress is being made, but we have not yet reached a point where services match demand, but all parties are aware of the issues and petitioning relevant parties for support. That's
Okay.
That was Liz Cook has made a suggestion there.
That sounds good. Can you say it one more time so people can
Shall I type it in the chat?
You're going to type it in the chat thing. Thank you. So Grant, back over to you.
Thanks. So I may have missed the meeting, but where this was done, but the various points we talked about the banding matrix, and what I thought it was agreed at some point that it was going to come back with some evidence or some information about the work that was done. So we were presented with a very early piece of work which was not very conclusive about how fair and equitable it actually was, and I thought it was going to come back so that we could be assured that actually it worked, and that actually schools were not going to sort of have these sort of cliff edge funding decisions. I don't know if that ever came back, but I for one would be quite keen to feel assured actually that it's not going to end up actually being a way of a blunt instrument that doesn't actually reflect the needs of individual children. Because again, I go back to that actually provision for individual children should not be based upon a blunt tool. It should actually be based upon individual needs. And unless there is, I'm very assured, in fact, that this is not going to be a way of blunting funding, which I'm afraid does happen in other local authorities. It's used exactly for that. It's used for depressing funding. I would have real concerns. So I'm all for fair and equitable, but that's good. You mentioned that you thought there was going to be an increase in the HCPs, but also talked about the fact that the banding tool was going to make a overall saving. So I'm guessing that you're going to tell me that the overall saving is going to be made because there are going to be fewer out of borough placements, or in independent, which is huge, but we don't have those placements yet. And my biggest worry is that knowing how long it takes to build things, create things, get it all up and running, that there's going to be quite a lag between being able to make those savings, not necessarily in next financial year, because it takes time. And I know that we've all done projects that don't run to time. So my biggest concern is, given that you have an imperative as a local authority to cut costs, and I'm sure the DfE was going to be breathing down your necks if your in-year budget isn't reducing, how can I be assured as a head teacher that I'm not going to have more children in my school with an EHCP placing demand on me, but less resource to manage it?
So there's a few things I want to come in on there, Grant. So we're not reducing the number of plans. So it's projected these will grow over the next few years. That's what we've modelled on in terms of the safety valve. In terms of the provision, when we look at the provision, we are looking at key stage provisions. The biggest pressure point we got at the moment is 6 to 7, yes, and we can expand and contract some of our provision as that need comes through. So in terms of that, as I said to you earlier on, we are negotiating with Sandhurst to open places now for September. Prior to the actual build being done, we are working with the school to sort of accommodate that within the school and doing some remedial works there to increase efficiency there. In terms of King's Academy, we have also expanded that now and opened all them places up, and I've met with Kate to make sure we have them places for September, and we have increased some of the other resource provision to increase capacity. So, it is fair to say that we have actually, as a council, even though we haven't got our buildings as such, we have increased capacity by other ways while the building work is ongoing. And I shared that at a heads briefing this morning with head teachers, and I'm happy, Grant, to share that with you outside of this meeting. So I can take you on the model of how many sort of places we've got. In terms, I can't guarantee, Grant, that you won't have a child that perhaps isn't suitable for your school. That's not a guarantee I can give, but what I can say is I can work with you to ensure that the right support is put in place in terms of that child, and that support should match Section F of the Child's Education, Health and Care Plan. So as long as we are matching that provision in terms of the banding tool, so that we are. Last year, before I arrived, head teachers moderated 72 children. They moderated 72 children across the area in line with the banding tools. When I arrived, I moderated the same children and applied the same principles. And when I looked at the funding, the values that were apportioned to the banding tool put approximately £22 million pressure on the high needs block. So we brought it back to the forum. We've said, yes, absolutely, we can adopt the tool, but we can't adopt the level of funding that was coming with the tool because it was financially not sustainable. So again, I'm happy once we've got the funding allocated, I'm happy for you to all work with me, allocated to the banding tool, that we actually do another moderation again. And I'm happy to use the same children as the benchmarking so that we can say, yes, absolutely, this is the right values for the right level of need. So, there is considerable work, and I'm happy to engage with any head to do that piece of work.
I think you'll have a lot of support with people helping on that. Granary, have your hand up?
Are you on? You need to press.
Liz, can I come in? Sorry.
Of course you can.
Yeah, slightly different point. So I've just sought some clarification, and until we've got the safety valve agreement that is finalised and signed by all parties, we are going to have to include formally in the report that you're agreeing it's subject to, in the way that you'd suggested previously, because until we've got everything finalised, in essence, the safety valve agreement isn't approved until that stage.
Thank you very much.
I don't really know.
We'll do the vote in a moment. You've got to put yourself mute. Thank you. So I look at the support that's come through, and then Tim, as you've very kindly written what I think we should vote to. There is an element of early door, which we're now having early support and advice. I still think part of the reason why schools struggle so much, and colleagues can correct me if I'm wrong, is that we get it as professionals. There isn't much money, but for the parents whose children are in crisis, that is what is the most heartbreaking to deal with, the most stress, the most demanding of parents for the children with the most need. So I still think there needs to be a bulking up of help to our parents. If there's any way to reduce their anxiety, and I'm not necessarily saying more money to them in the long run, but the advice that our parents are getting is often get a subject access request from the school, go in and offer a complaint, have a team around the family, and that only creates more pressure. Okay, so of course we want to do everything we can to support, but the more we can help our parents of the most vulnerable, I think that would make a lot of us easier. Okay. So Tim, you very kindly said that we should vote to this one. So progress is being made, but we have not yet reached a point where services match demand, but all parties are aware of the issues and petitioning relevant parties for support. Are we agreeing to that?
Liz, sorry, I think we have to directly answer the question. So I think we had this issue last year. We have to say whether we think appropriate arrangements are or not. I think we can say not yet in place and then follow it with Tim's comment to put some context to it. But I think we have to answer the question.
So the question was that their education of pupils with SEND, and we said progress has not yet been made.
We can say not yet in place, but progress is being made.
Kate, Grant, Kate, you came in first, and then
let Kate go first.
Thank you. I agree with what Stuart and Tim have proposed. I think that's a good suggestion. I also just want to say before we vote on 3.2 is in two parts. We've discussed the SEND part, but we haven't discussed the pupil referral unit part. So we can't vote, I don't think, until we've discussed the whole section. Sorry.
It's all right. Let's go to 3.22 and talk about that section then. So, Kate, start us off.
Thank you. So just in terms of the education other than in schools, I just wanted to note, and it is similar to what we said for SEND, in as much as there are proposals in place, but we're being asked to vote on arrangements where there's a consultation underway, but the consultation is not yet complete. And it is clear in the paper on page 92 that a final decision has not yet been made regarding the pupil referral unit. So again, we're being asked to say that there are appropriate arrangements in place for the use of pupil referral units in the education of children otherwise than at school. But there's kind of a caveat to that, because surely that is dependent on the outcome of the consultation. I don't know, Dwayne, if you can shed light on that.
Yes, so what we've done in terms of, we've gone out to consultation, we've done a pre-consultation with staff in terms of the closure of the pupil referral unit. And obviously sort of management committee have written to the DFE to say that it's not financially viable. What we have done in terms of appropriate provision, we have reduced the PAN from April. So in terms of the school PAN, that's been reduced to 29 places from April, and we will further reduce the places come September if we don't get permission or we don't get, we don't go ahead with closing it down for whatever reason. The proposal we putting out into the consultation is that we do close it, and then so whatever way we will have suitable arrangements in place, Kate, because if we don't close it for whatever reason and we can't, then the PRU we'll have places there. It won't be at the level it is now, because at the level it is now is currently 56 planned places, and we've only had 29 children in there for the last few years anyway, so we are reducing that. If the proposal and the consultation agrees that we can close it, then we will have suitable arrangements under the commissioning model for the local authorities section 19 duties. So it's our duty when a child has been permanently excluded from school to put in place a 6-day provision, and under the medical needs EOTAS, that's on the 15th cumulative day of an illness. So, what we have is, we will have that provision, and we currently have that provision as the local authority.
Thank you for that, Dwayne. That does shed clarity. That makes that clearer. Thank you. And also, just on that, I think the other thing to note is we are only voting for the 2024-25 financial year. So I guess if numbers change or consultation outcome change, we would vote again next year for the next budget anyway. So thank you. Thanks for that.
Stuart, over to you. Thanks, Kate.
Yes, sorry. I in part agree with what you say there, Dwayne. We might meet our requirement on the provision, but I think we have to be very careful as Schools Forum that the provision is Ofsted inadequate. And I would be uncomfortable saying that it is an appropriate arrangement to move a permanently excluded child to a school that is inadequate at the moment. As I said this morning, I think we've got to acknowledge the progress that's been made, but I think in Schools Forum, we've got to make sure we're clear that actually we might be offering the places, but are the places appropriate? And I don't think this goes anywhere other than Schools Forum to note. But I think we have to be careful. I would be uncomfortable saying that it is appropriate when we're sending them to an inadequate. Sorry.
No, and I totally understand that. But what I want to sort of also raise is that we are being monitored by the DFE, and we are going through that monitoring process. We have not stopped that just because we are looking to close the PRU. We have continued with that with the rapid response team and the school improvement team, and continuing to work with the management committee and the head to put in the measures to make sure we are on the action plan to correct, the Ofsted outcome.
Thank you. Any more comments or thoughts before we do finally vote on 3.21 and 2? Okay, so we've heard we need to make an agreement on there are appropriate arrangements in place for, and we've got a not yet proposed, and we've got a yes. So for a not yet, with the addendum that Tim has added to it. So not yet. But that is not to, hopefully you have heard, Dwayne and Grania, that people are saying there is improvement. Okay, we don't want you to think that we don't see them, we don't feel some of that movement. So the School Forum notes the updated forecast for financial position of the high needs block budget at table 1, which shows as forecast £5.321 million overspending in the 24-25 and a £41.533 million cumulative deficit on the high needs block as at the end of March 2026. Noted. More messages. So not yet with Tim's amendment. Thank you. Those comments in notes. And provides comments on the latest 24-25 budget proposals on council funded services, which arise from the safety valve proposals.
Can I come in on that, Liz? Because perhaps I need to sort of, and could I ask colleagues to look at that page, because this is the, sorry, I'm just going to pull the report up because I want this to form part of the consultation with you. So if you remember the workshops we did, all of us, in terms of the safety valve, we have looked at that. Sorry, we've looked at the outcome of that in terms of what services we need to amend, and we've taken on board all your feedback. So to ensure the top slice from schools, we acquired a 1% top slice from schools. As colleagues are aware here, the council agreed that we would, from the council funds, pick up 265,000. So to ensure that we take that cost from schools into the council, and I'm looking at the page 109, these are the further savings I have looked at with my colleagues from the council in terms of meeting that. So can I just talk through? So I would do really want to take any comments on this. So what we've done in terms of 24-25, and the savings are being done over 2 academic years. The proposal is to save 24,000 in the first 24-25 and further 7 in 25-26, and that is to look at administrator and from part of the service and from the governor's post and to amalgamate it there. When we look at commissioned, and I said this morning at the heads briefing, we have commissioned the Fisher Family Trust and Management Information's MIME. So we are saying we're not going to commission them anymore. So that saved us 17,000. We've taken a further 12,000 from the pension fund, and as Gráinne mentioned this morning, that is those that unfortunately, are less pressure on that budget because of unfortunately passing away. In terms of the Open Learning Centre, we are increasing the revenue there of 20,000. In terms of the property, for my colleagues here, Noreen Sarif, we have not replaced Noreen's role, and what we are doing with that role is replacing it by a 0.5, not a full-time equivalent role. The other one we need to sort of take on board today is the Not in Education Employment and the NEET budget. So this NEET budget, and as you remember from our workshops, was set at around circa £400,000. The proposal, in order for us to meet the £265,000 top slice cost, is that we're proposing to reduce that budget by 125,000. And again, this was an area when we did the workshops for the safety valve, the colleagues asked us to look into as well. We've historically have underspent on this budget, and every year has been sacrificed as a saving. So what we're saying is we want to right size our budget around the NEETs. There are 83 children in our NEETs in that cohort at the moment where, we are supporting. So, this then, the total over 2 academic years will come to 265. And that 265,000 is the top slice, is the money that we said we would pick up from the top slice of 1% from schools' budgets. So I do need Schools Forum comments on the above, please, if that's okay.
Who wants to start? Okay.
Just to pick up on the last point that Dwayne was making about the NEETs budget, that was one area where I was concerned, but I think that Dwayne has made that clear that the money wasn't actually being used. So it's essentially not a cut, it is a bringing in line. So that was really helpful, Dwayne. Thank you.
Thank you. Anyone else? No, thank you very much. So we've noted, we've given you a few comments. Gráinne, you've got one more thing for us for the minutes. So the safety valve arrangement is progressing through the final stage of approvals, but as yet we can't confirm that it's been agreed by all parties. Therefore, the recommendation does need to include subject to, as previously debated. Makes it much easier. Thank you very much. So that brings us to the end of our meeting. Dates for future meeting is 4:30, 20th of June, and it's a Thursday. I just want to say thank you to everybody who's presented today, who's contributed. I really do appreciate people taking the time to read some quite complex papers and making my burbling efforts as chair that little bit easier. So thank you very much. Jamie, you can stop the live stream now.
Thank you.